Greetings. My name is Janet Laval. I am the Director of Health and Wellness Ministry at Clinton A.M.E Zion Church, and I would like to take a moment of your time to talk about monkeypox. Monkeypox is a rare disease caused by the monkeypox virus, which is part of the same family of viruses that cause smallpox. It is not related to chickenpox. And prior to 2022, monkeypox has been reported in people in Central and Western African countries. As of August the 12th, there are 11,000 confirmed cases reported to the Center for Disease Control. The majority of those cases are in California, New York, and Florida, while in DC and Maryland, there are roughly 600 cases. How is monkeypox spread? Monkeypox can be spread to anyone through close contact, often skin to skin. Direct contact with monkeypox rash, scabs, or body fluids from a person with monkeypox, touching objects, fabrics, clothing, surfaces, and contacts with respiratory secretions from a person with monkeypox. Who is at higher risk? In the United States, 98% of the cases occur in men who have sex with men. People are more likely to be diagnosed with monkeypox if you have close contact with someone, multiple sexual partners in an area known to have monkeypox, and certain jobs that expose persons to viruses, such as laboratory workers and persons performing the test for the virus, laboratory workers who handle cultures, healthcare workers, and public health workers, and that also includes maintenance people. A pregnant woman who contracts the virus can expose her unborn child to the virus, and those with compromised immune systems may have a worse disease. Signs and symptoms of monkeypox primarily include the rash, which initially looks like pimples or blisters. It may be painful or itchy. The rash will go through several stages, which includes scabs before healing. There are other symptoms: fever, chills, swollen lymph nodes, fatigue, muscle aches, headache, sore throat, nasal congestion, and cough. Some people only experience the rash. Symptoms may appear 1 to 4 days before the rash, and usually within 3 weeks of exposure to the virus. The illness typically lasts 2 to 4 days, 2 to 4 weeks, I'm sorry. So to prevent monkeypox, you need to limit your activities that could potentially expose one to the monkeypox virus. You want to consider vaccination protection if you are at high risk. So per the CDC, a previous smallpox vaccination does provide some protection against the monkeypox, but though that protection wanes over time. Experts advise that anyone who had the smallpox vaccination and is more than 3 years old and you're at increased risk for the monkeypox, you should get the monkeypox vaccine. Diagnosis is made through DNA detection, looking under a microscope, blood sampling, and cultures. There are no specific treatments for monkeypox because the virus that causes the monkeypox and smallpox are closely related. Medications that were developed to treat smallpox may be effective for monkeypox. Medications directed against the virus, antivirals, have been recommended for some people who become more severely ill, and they do have side effects such as nausea, vomiting, abdominal pain, and headache. Most people with monkeypox recover fully within 2 to 4 weeks without the need for medical intervention. Are our furry friends at risk? Well, infected animals can spread monkeypox to people, and it's possible that people can become infected by our animals through petting, and then we cuddle with them. However, the CDC does not currently believe that monkeypox poses a high risk to pets and is monitoring the situation closely. Reliable sources of information. Note that the operative word here is reliable. So you can always go to your healthcare professional, seek out the Centers for Disease Control online, National Institutes of Health, Medline, and clinicaltrials.gov. This concludes, well, Clinton has decided to seek out our friend and Clinton's technical consultant for health and wellness and supporter of Clinton A.M.E. Zion Church, Dr. Beverly Alston Smith, who is an immunologist at the National Institutes of Health, for our reference on monkeypox. Thank you, and this concludes my presentation.